Sierra Leone.
The greatest humanitarian challenge of our time is actually the migrant and refugee crisis. We will continue to look for ways in how we can play an appropriate role in addressing the long-term refugee and migrant crisis.
There's lots of need in Africa, and I think it's an important place for us to be operating. I think we've gotten to a couple of very interesting initiatives going on there, not least of which is starting to get involved with Nelson Mandela Children's Hospital Foundation and their children's hospital in Johannesburg. It's interesting when you look at Africa how few children's hospitals actually are there, and the issues of things like childhood mortality and major children's issues that are still out there.
Last year, for example, when there was that devastating earthquake in Nepal,
we were the first responders.
Within days, the Project Hope team was there on the ground, helping out with evacuations, helping out with patients, both those wounded, those requiring intensive care.
And then the second week, we worked at a hospital that Project Hope had already had.
It was a massive undertaking, but we were there.
There were doctors, nurses, lab techs, everybody, different backgrounds, all working together.
And we also were able to ship millions of dollars of life-saving medicine.
When you see what we're doing on the ground, and the work that our people are doing on the ground, that's what keeps bringing you back for more.
It all kind of falls on the backs of these wonderful grassroots volunteers, and when you have that kind of success with your groups and your grassroots groups, then I think that you can always do great things.
We have incredible capacities across the board, across our different departments. When all of those pieces work together, we can have, I think, the most significant and long-term impact.
If you talk to the volunteers and you look at what they're doing out in the field and the impact they're having on people's lives, it's just really compelling, and I think the organization does that to you. It does kind of just draw you in when you see what compelling work we do.
The depth and breadth that Hope has of its volunteers, the level of volunteers that they have, how highly educated these volunteers are, and the passion that they have for the work that they're doing truly comes through.
What Hope allows is ways for people to give.
It can be through gift in kind, it can be through volunteering activity, it can be financial. It's really about making a commitment to the organization and contributing however you can do.
Hope provides an opportunity to do service to others in its many different forms.
I look at this as a really major celebration of the things that we've accomplished over the course of the year.
Sometimes making hope happen is to get someone their insulin. Sometimes making hope happen is building a children's hospital.
What hope means is just that, is hope. We can offer solutions to many of the